In the complex world of healthcare reform basics include the policy and procedures to improve the healthcare delivery system, involving government, insurance companies, employers, and the public for those needing care. Healthcare reform is expected to find solutions that ensure more people who need coverage, provide more choices of providers, allow more access to specialty providers, deliver more quality patient care, and lower costs of healthcare. The Patient Protection and Affordable Care Act, or ACA, was signed into law in March 2010 to begin a process of changes to the U.S. healthcare system and choices for the public. The online marketplace at healthcare.gov walks a person through options to become insured. The basic purpose is to encourage all citizens to become insured. Let's join Mr. and Mrs. Jones as they look at the options and walk through the process of choosing the best plan for themselves and their 4 children. Here are the choices confronting the healthcare consumer today. Option 1. Stay uninsured. This means the family would have no coverage. The data from the beginning of 2016 listed by the Centers for Disease Control and Prevention, or CDC, showed 27.3 million Americans were uninsured, 8.6% of the population. The Jones family finds this option to be the least expensive, until one of the 4 children needs a surgical procedure. Option 2. Purchase healthcare privately. This option is very expensive. Mrs. Jones has a job that pays just enough to get the family through the month. Purchasing insurance on her own would cost more than $1,500 per month. Option 3. Purchase employer coverage. The employee has insurance coverage only during employment. The employer may cover some of the cost and may provide a network of physicians and other service providers to reduce cost. The cost of this option is increasing for the employee. Mr. Jones is employed by a company providing health coverage, which will bring the cost for his family down to $800 per month. Option 4. Purchase exchange-based coverage. The Affordable Care Act marketplace, or state plans, may provide an exchange program for coverage. Information can be found at healthcare.gov. This option for the Jones family would cost around $1,300 per month. Option 5. Use a flexible spending account. The client can put away pre-tax dollars for healthcare expenses. Mr. Jones opts to have an extra $50 taken out of his paycheck each month to help with deductibles. Option 6. Use a healthcare savings account. This is an option with high deductible plans for a pre-tax savings account to cover medical expenses. There are advantages to private insurance subscriber networks based on the group's particular needs. For example, BMW has employee insurance and medical care, including lab, x-ray, dental, vision, and pharmacy at the workplace. Based on their research of the options, the Jones family decides to go with their employer coverage. It's time to get to the core of some of the many reforms now in place. Providers' payments are being linked to performance. This is called value-based purchasing and is an effort to compensate providers and hospitals for quality care. One of the chief goals of the Affordable Care Act is to increase quality of care and decrease the cost of insurance premiums. This goal has effects on many areas, according to the Centers for Medicare and Medicaid Services, or CMS. Insurance companies should try to decrease the cost of premiums. Physicians are advised to deliver quality services that are measurable and necessary. Documentation is required to support what was done and why the treatment or procedure was necessary. Nurses and staff documentation of care provided is crucial to track quality. Staff must record what was done for the patient and family during the visit or admission. Hospitals must meet quality guidelines, such as no hospital-acquired infections. CMS is responsible for direction and oversight of the statistics on how well the healthcare industry is performing. According to the CMS website, there are multiple items to be reviewed and reported based on the patient's conditions, procedures performed, and the outcome of the care provided. The items audited and goals to reach include readmissions to hospitals, no unplanned readmissions in 30 days, screening of patients for fall risk, report falls and investigate the cause, patients receive pneumococcal vaccine, reduce incidence of preventable illness, influenza immunization, reduce influenza cases that can lead to complications, and sentinel events, tragic outcome, reduce errors that caused harm. Auditors in physician offices and hospitals are working to obtain clinical information from the patient's electronic health record, or EHR, to be entered into software designed to track quality services and ensure proper payment. This is a checks and balances system to identify problems and maintain accurate information for both providers and hospitals. This is a major reform for the healthcare industry to observe where the problems occur and alert the providers and hospital leadership. This is like turning a large cruise ship in the middle of the Mississippi River. Reform of this magnitude takes time and adjustments in the process as the healthcare industry shifts. Healthcare systems are reeling from the recent changes and must adapt quickly to get paid. The patients are in the middle of navigating this transition. Consumers can choose to stay uninsured, sign up with employer insurance coverage, visit the marketplace for an exchange-style plan, or sign up with a privately funded subscriber network. Healthcare reform is expected to find solutions that ensure more people who are not currently insured, provide more choices of providers, allow more access to specialty providers, deliver more quality patient care, and lower costs of healthcare. CMS is reviewing facilities for quality. Some of the measures reviewed include readmissions to hospitals in 30 days, assessing patients for fall risks, and immunizations for influenza and pneumococcal infections. Auditors pull the information together from the electronic health record and submit reports to CMS, which monitors quality and ensures payment. This is only a portion of the change confronting healthcare facilities and care providers.